The CDC has indicated that in-person instruction in the fall is priority. But is it safe to send our kids? Stay tuned as we will discuss returning to school during COVID-19 and much more you don't want to miss. All right, fam, welcome to Live with Texas Brown Sugar. How's everybody's week going? If you can, comment in the section below and let me know with an emoji how you feeling. Maybe you are really super cool and chill today, so you got the emoji with the sunglasses, or maybe you need a palm tree because you out on vacation, relaxing, or maybe it's just been a crazy hectic day and you need a martini, so you're gonna comment with a martini. Let me know how you guys are doing out there. Um, you guys do not want to miss. Stay tuned because at the end of the show, I will pick 3 random people to win one of these shirts to remind your children and the children around your children to social distance. So stay tuned. I'm going to pick 3 winners. Hopefully, it will be you. And if you are new to Live with Texas Brown Sugar, welcome. Um, at the top of the show, we always start off with a toast. And today's toast, and you don't have to have wine or hard, maybe you need some little hard liquor, but you can get some sparkling water or even some, hey, tea. Today I got a little mango flavored vodka. Interesting. But today we're going to cheers to the kids going back to school. I'm definitely going to cheer to that. Amen. So today we have a special guest family. I am very excited as we have our very own Dr. Gina Blocker. Dr. Blocker is a board certified emergency medicine physician who is dedicated to delivering high quality, compassionate care. American Board of Emergency Medicine with over 10 years of clinical experience. She is a U.S. Army veteran. Thank you for serving. With over 10 years of active duty. She has dedicated fellow. She's a dedicated fellow of the American Academy of Emergency Medicine, where she served as the chairwoman for the Diversity and Inclusion Committee. I can attest to that. Amen. She spent more than 10 years in academic emergency medicine, supervising medical residents, student nurse practitioners, and physician assistants. Please, ladies and gentlemen, help me welcome Dr. Gina Blocker.
Thank you for having me, Lessa.
Yay! So, Dr. Blocker, as you all know, the CDC wants us to go back to school. But at least here in the state of Texas and some other states, there is no mask mandate. What are some of the things that we can do to help keep our kids safe? Let's start at the elementary school age.
Sure. First, I want to start by saying today it was sort of a paramount day for our nation in that the CDC did let down that mandate for all federal workers as well, encouraged all school employees, staff to include principals and those that work with the children in the school to wear a mask. And that came down today. We are all in this COVID-19 surge of the Delta variant. And currently we are seeing surges all over the country, mostly in major city and metropolitan areas. We need to put the word out there to get vaccinated, as well as the word for our children to go back to school, kids do get COVID. And it's important to encourage mask wearing. It's important to encourage hand washing and distancing as our children are in closed, confined spaces in the schoolhouse. So I'll start there. For school-age children above the age of 2, it is encouraged and highly recommended that masks be worn in closed quarters, which would be the classroom. We are allowing children to play outside without masks, but we also encourage those that are working with children that are or are not vaccinated to wear masks. That's all adults that are working with children from the grades of K through 12. We all know that the vaccine is widely available, and at this point, only about 40 to 45% of the nation is vaccinated. Those numbers tumble down in large metropolitan areas and in most of our red states. So Texas to be included, there's no mask mandate for back to school. However, I highly encourage those that have children above the age of 2 to wear a mask, as well as parents. There's some advocacy here for parents. It's important for parents to inquire whether their teachers are pro-mask. It's important to ask the principals how many of your teachers and staff are vaccinated. That's all good information to know, because the Delta variant, which is surging at 80% now of positive cases, are such subtle symptoms. Some of the symptoms that would be in this fall weather to be correlated with allergies or the common cold. We didn't see much of the flu virus last year, but the flu virus and what I call the OG coronavirus. The coronavirus is an old virus. There are many strains of the virus that COVID-19 is new on the block. So you may know the OC43 strain, which is a coronavirus, which is the common cold. If you look on the back of your Lysol bottles, you'll see that it's 99% effective. Lysol's 99% effective for the coronavirus. It's not a new virus. It's a novel strain. And so I encourage parents that have kids with seasonal allergies. I've had children come in my emergency department that have been positive for COVID-19 and other strains of the COVID virus. So it could be allergies, or it could be COVID-19, or it could be the common cold virus, rhinovirus, RSV, respiratory syncytial virus. There are other viruses out there that are going to be, welcoming themselves into our schools this fall and winter. So I highly encourage you to protect your children against the Delta variant. Whether you're vaccinated or not, encourage mask wearing. I'm going to talk about how to have what some of the best hacks for getting a child to keep a mask on above the age of 2, and we'll kind of get into that as the conversation goes on.
I have a audience member on Instagram Live who's saying that she's seeing the same at her office, and she's a nurse for a pulmonologist. Ooh, did I say that right?
You did.
Hey.
So we're seeing so many subtle symptoms with this Delta variant, and that's the message that I also want to get out to parents tonight, is that common symptoms of COVID-19 in children and how they present. And so I'm seeing a lot of nasal congestion, itchy, watery eyes. These are the same symptoms that are analogous to, again, as I said, seasonal allergies. Now, am I saying every child with a runny nose needs to be tested for COVID-19? No. But if these symptoms are prolonged, if your child seems more lethargic or more disinterested in eating or drinking, or complains of headache or gets a fever with his allergy symptoms, those are symptoms that you also need to pay attention to. We talk about back to school. A lot of moms, such as myself, are interested in back to school stuff. What does your child need to be safe and keep safe for back to school? We are seeing now that most teachers are adding extra tissues and Lysol wipes. What are some things that you as a parent can contribute to the classroom? I highly recommend disposable masks. Send a box of these with your children. Send them to the teachers. If someone's sick that day, they can ask them to put a mask on and protect the classroom from spreading symptoms of maybe it's a cold or maybe it's COVID-19. So throw these into your back to school supplies, extra tissues. Some parents are buying face shields for their child on Amazon to send back, and enough for the class. Do what you think may be necessary to keep your child safe. I worry less about what other children are going to do to keep my child safe and try to focus on what I can do to keep my child and other children safe. A box of these disposable masks are great to send with your child to go back to school this fall.
Man, Dr. Blocker is giving us some gems right now, and hopefully you all are taking this all in. Make sure that you share this, as it will be on replay with one of your family members, friends, coworkers. It's very important that we take this seriously. What are some of the things that you're seeing in the ER with children that, as we previously discussed, are indirect results of COVID-19?
Right. Well, first, I want to debunk the myth that kids don't get COVID. Children do get COVID. They often present with less severe symptoms than an adult, but they do get COVID. And you may have heard of the subset of children that get a severe form of COVID called MIS-C, MIS-C. And that is a compilation that can require, a child that can have a child exhibit pretty severe symptoms to include multisystem organ failure, first starting with the respiratory system. Again, then going into cardiac failure, those kind of things. It is quite rare. However, I've seen it happen. So protect your child. Most children that are going back to school this school year, we hope to keep healthy. And I'll just say, what one of my colleagues said in an interview with the CDC today, children are meant to be protected and children are not meant to die. So we should not expose children unnecessarily to viruses that we have a means to protect ourselves against. It's important for parents to become vaccinated. The vaccine, of course, will not prevent you 100% from contracting COVID, but it can also very much help decrease the spread of the illness. Studies aren't out yet. We don't know how infectious vaccinated people are and how they can transmit the virus. But studies do show that those that are being hospitalized with this Delta variant, 94% of those people that are being hospitalized with this Delta variant are unvaccinated. Okay. We do have vaccine breakthroughs. We do know that adults can transmit virus to children. Okay. And kids can get sick. Be vigilant. Protect your children. Send them with masks. Don't send your child to school if they're vomiting or they have diarrhea or if they have a fever more than 3 to 4 days, more than 3 to 4 stools in a day. They can become infectious if that's COVID-19 and there's a source. So it's important to be able to identify symptoms in young children. Again, they're more subtle. They mimic very similar viral illnesses. And it's important for us to show our children how to protect themselves. Let's start first with effective hand washing. Many of you may have heard sing your ABCs and soap your hands and wash them. And when you're finished, that your ABCs, your hands are effectively washed. I would encourage you to tell your children to wash their hands at least to the mid forearm. That way they're getting all the bugs that can, their sleeves, those kind of things. Pull your sleeves up and wash to the mid forearm. That's important. It's also important to tell your children to use hand sanitizer throughout the day. Those things really are important as they're moving from classroom to classroom, from specials outside to large common areas as the cafeteria or the gym. Those things are really important. Just remind them to continue to wash their hands. I've also attached small travel-sized hand sanitizer on my children's backpack and on their lunch bags. So that's important that if they don't use the bathroom before lunch, they can still wash their hands and keep their hands clean before they eat. So add that to your back to school list. Travel size hand sanitizers for the lunch bag and for the backpack. Very important. As are hand wipes. I would add those to my list as well. Little, wet wipes that have, safe chemicals in them, nothing with Lysol or bleach that's going to touch your child's mouth. But the little travel size hand wipes are really, really helpful. And young children can use them and throw them away.
Now, let's reel back in, and so that we can clearly explain to the audience what we should look for as far as symptoms for COVID-19. And you'd mentioned diarrhea, throwing up. Is there anything else that we should look for as well?
Nasal congestion with the Delta variant that's so common right now. The patients I'm seeing are not losing their smell and taste so much. People are more nasal congested, and that's why they can't smell versus not being able to taste. So I would highly encourage you to watch your child's behavior. If they are not using the restroom, not drinking fluids, if you see that their mucous membranes, their tongue is not moist, those kind of things are very important. And if they're under the weather, you know your child best. I tell my patients and my moms, my parents, that you know your child best. So if you do take your child in, make sure to highlight what's different in your child's behavior. His play is not normal. He's not eating and drinking well. He's not using the bathroom. I'm noticing that he has more runny stools. I'm noticing that he's sleeping more, those kind of things. Again, very similar to viral illnesses, but still need to be checked since there's a source for COVID-19.
Great. Now, we had talked about the vaccine and a lot. Is the vaccine available for all children right now?
The vaccine is not available for all children at this time. I'm very hopeful that the vaccine will be available to children 12 and under by the first of the year. It's just they're testing safety protocols at this time. The CDC has protocols that they need to get out and get past and through multiple rounds of intense testing. And so they're not skipping any steps there. And so there have been multiple clinical trials that have enrolled children in test trials that have received the vaccine and placebo. And specifically, I know some of those children myself, and have talked to many parents, and there have been very few side effects from the vaccine in children in the ages of 12 and under. It is highly recommended for children ages 12 and above to get vaccinated at this time.
And we want to make it clear too, even if our child is vaccinated, it's a possibility they could still contract the virus. Is that
Absolutely.
correct?
The vaccine does not prevent you from getting COVID-19. It makes you less susceptible. But the main point of the vaccine, and this is, I want to be very clear, is to decrease the severity of symptoms, respiratory symptoms, and ongoing to, worsening overall general health and wellness.
Very good point. Facts. I'm telling you, Dr. Gina Blocker is throwing some gems out here. Please throw a thumbs up in the comment section if you are gaining something from this. I know I am. Hit the like button. Let us know that this is something that you are definitely gaining some knowledge from, and be sure to share this with any and everyone, please. It is very important that we keep our children safe. I know we briefly discussed school age. What about, is there anything else we need to be concerned about for those under 2 years old?
Absolutely. So in the daycare setting, things are a little bit more difficult to assess, just because those children are mostly unmasked and, of course, unvaccinated. It's very important that the caretakers are wearing a mask. We've seen transmission within daycares, not to the rate as we've seen in the other extreme of age of nursing homes, but with this Delta variant, it could definitely get there. So just because of the level of asymptomatic transmission. right? I mean, most healthcare workers are getting vaccinated because we're in contact with the public. And I believe that school workers and those that are in close proximity to our children should really be taking the highest and utmost precaution to transmitting this virus, especially with this Delta variant that's now on the surge. One other thing I wanted to add is that, as a mom myself, as a working mom inside and outside the home, I want to kind of highlight the importance of childcare in this time. So when your child's sick, and as a mom, it's really important because sometimes it falls on the moms to have that backup childcare. Identify someone in your village or in your community who can pinch hit for you. If you have to get to work, or if you're not working from home and your child's sick, I encourage you not to send your child to school without checking with their pediatrician or getting them seen by a healthcare provider, preferably a physician. I highly recommend that you identify some sort of backup childcare at this time, whether it's a nanny or a babysitter or a neighbor that can pinch hit for you in the short term. Just another thing to add to your list of getting ready to go back to school. I myself have a close neighbor and friend who I know I can call for pickups if my child gets sick, and then also a nanny who can help pick up my child if they're sick. I help identify that person early so that you can be preventative instead of reactive. We have so many stressors during this time. You want to decrease the things that could make things more difficult for you once that difficult situation arises.
Good point. I think I have someone. um, so speaking of the healthcare workers, ensuring that they are masked up, can you demonstrate or at least tell us the correct way to wear a mask? Because I see a lot of people, I believe, are not wearing it correctly.
Sure. So this is a regular disposable mask, and it's important for children. If you have a regular size mask, they sell these in children's sizes. The pediatric size, they do sell. This part is smaller, and these are less elastic for children. If you don't have those masks, of course, we can always do the ear twirl. So if it's too small for the child, you can do the ear twirl and twist it around the ear. For a child, it's going to be really important that the mask adheres above and below. The sides sometimes they're gonna pull down as you pull your mask on and off. But for a child, it's important for it to stay in place, that you earmark the nose and pull this down enough where you can have somewhat of a seal here at the chin. So the mask should reach the child's chin. If the mask is here underneath the lip, it's not going to be effective because you have too much gap on the side, which you can see here. Okay, so the nose to the chin, the child should feel comfortable putting this around their ear and putting this around their ear. This is a pediatric mask, so it's small for me. Make sure it's centered, okay? And you want to make sure that the mask is equal and that it doesn't cut on their eyes. Now, for children that wear glasses, you can buy fog protectors so that the child keeps it on their face. You can buy fog protectors and treat your glasses, or you can treat the inside of the mask as well with fog protector, okay? But the most important part is that the mask is equal underneath the eyes, and that you have this seal here and that it meets the chin, okay? And if the child's face is too small for this mask, again, you can twirl the ends of the ear like this and cinch it behind their ear. It sometimes can get uncomfortable for children. That's why it's important that the mask is sized correctly. I'm going to put a plug in. I don't have any here with me today, but happy masks are very effective and children keep them on a long time. My children use them for plane rides. They've been excellent, and they have more mouth space so a child can speak and not feel like their mouth is restricted. They also don't get wet. They absorb a lot of that moisture, and it's water wicking. So www.happymasks.com.
Okay, I'm putting that in the chat.
Mm-hmm. And just to encourage parents to send their children masked, I will tell you that the surge that we're about to see once kids go back to school is going to mimic what we saw in the spring of last year into the summer months as things surged. Except it's going to be a little bit more mysterious. So this Delta variant is more asymptomatic carriers and spreaders. Our children deal with respiratory illnesses relatively well. So we'll have a lot of asymptomatic children who will spread and not show any symptoms. Or very subtle symptoms. So I highly recommend that if you think no one is sick in your child's classroom, there could be 2 or 3 children in there with COVID-19 who are showing no symptoms at all. That's the Delta variant. And that's the part of this going back to school without the mask mandate that worries me the most as a physician, is that most children present very subtly. And without showing signs of sickness, we may not know soon enough who needs to put a mask on.
Wow. I better make sure I have my mask bought. And I know Costco has for $10, I think it is, some masks. So they're not very expensive right now. So good to know. I know we've talked about the physical aspects of COVID-19. What are some of the non-physical aspects that we should look out for and pay close attention to concerning COVID-19?
Sure. Especially in our children, who, as caretakers, we're all caretakers if we have children, want to protect our children from the things that they don't see coming. And what I mean by that is some of the subtle ramifications of this virus are social isolation. Children do get depressed and sad about missing their friends or being virtual or not being able to have play dates or participate in after school activities due to the COVID-19 virus. So many things have been canceled, plans and family gatherings, and they take a toll on our children. And I think it's important for us to acknowledge that, Lessa. I think it's important for us to not forget the untouchables, right? This mask I can touch and I can focus on it, but it's not the most important thing when it comes to the health and wellness, general wellness of my child. And what I mean by that is there's something called overall general wellness and health that helps our children progress through the different stages of adolescence and childhood. And it's important that our children have a global awareness of wellness, and that despite the things that are in our world that we can't control, we can control what we pour into our children and what gets poured into them. I don't want you to miss that. What gets poured into them. And we need to, at this point, use our village. The people who are on our quarantine, okay? Everybody sort of has a team of people that they quarantine with, right? People that we call our safe, our safety, our home base. And it's important that we draw upon those people to pour into our children, the people who can be around them and love them, encourage touch in those safe environments. I know as a mom, I try to hug my kids more and give them more interaction, physical touch and awareness, doing more things hands-on with them, even playing with them with cars or doing science experiments at home, or even having close friends over who our family is quarantining with if we have to quarantine at that time. But engaging our children, using our hands and our hearts to really understand where they are. They don't understand Delta variant and all those different things that come with the mask mandate and governors and the political, all those things behind what we're dealing with right now as a world, as a country, as a state. We need to be pouring into our children, allowing them to have emotions, okay? And congratulating them for feeling and expressing those emotions. I think some of that goes unseen when we're worried about the masks or who's sick in the classroom or staying home from work or maybe losing your job in this pandemic, okay? So if it's not you and if you're not able to pour into your child at any given moment, reach out to a neighbor who you trust or a friend or whoever's on that team that you have, and try to pour into your child, connect your child, do hands-on things with them, touch them, love them, and encourage them to share with you the things that they're feeling in the classroom. Whether they weren't able to go out to play or they haven't seen their friend for 10 days because their friend is out sick with COVID. Encourage them to write down their feelings. I have a writer, one of my 4 children is a writer, and she loves to journal. And I encourage that in her. And I allow her to pour out her feelings with her siblings, allow her to cry or be upset. The normal things you do, but pay more attention to your child and do more hands-on things to engage them. It will help them overall with their mental health, but more importantly, it'll draw you closer to your child and open up that line of communication with your child in this time of COVID-19.
Wow, I greatly appreciate this informative discussion we're having. I want to take the opportunity for anyone who is streaming with us right now. If they have any questions, please feel free to ask them in the comments section, and we'll see if we can get Dr. Blocker to answer. Again, I hope everyone is gaining some valuable information from this. Again, as Dr. Blocker said, children are not meant to die. We want to keep them safe and protected. And so let's do that and get these masks into the school, despite what your state has suggested or recommended. So please, again, if you have any questions, go ahead, ask them in the comment section. Before we get to that, Dr. Blocker, is there anything else that you would like to add that we may have overlooked, or something that you think is just very important for our audience?
Sure. One more thing I'd like to add is, as most households, every household is different. Some children will live with 2 parents, a grandparent, a cousin, one dad, and multiple other siblings in the home. Every home looks different. Every family looks different. And the health status of those living within the home with those children that maybe not masking in the classroom, or now with this mandate in Texas, we don't know who's masked and who's unmasked, is that protect the people at home that have multiple comorbidities. So if your child is coming home sick, it's very important to get them seen by a provider. It's very important to protect those in the home who are undergoing chemotherapy or who are sick with diabetes or hypertension, or have other multiple comorbidities that may put them at an increased risk for multiple sequelae, bad sequelae with respiratory viruses such as COVID-19. Again, those children can be asymptomatic carriers. So maybe your child's not even coming home sick, but then someone in your home who's maybe undergoing chemotherapy, like I said, or a diabetic or African American with multiple comorbidities. Those are the people to definitely protect in these times, and important to quarantine if they're having symptoms.
Great. We have a question from Brin812. She says, "Hi, doctor. Any suggestions for us as nurses who are in office seeing the children for resources for families that don't have their quote unquote village?"
That's an excellent question. The resources that I'm aware of are quite limited for sick children in the pandemic. However, I will follow up with that and get that answer for you. Symptomatic children at this time there are going to be a lot of children sent home with general fevers and cough, cold, congestion. They're going to be calling parents to come get their children. It's really important that we document symptoms and temperatures and those kind of things. As far as childcare, that was the question, correct? Childcare. As far as childcare for sick children, it would probably most likely be the parent identifying something for their child. School districts at this time have not put out any guidance to address sick children whose parents are not able to quarantine with them, but I think that's a very valid point that if parents can't send their child back to school and they have to go to work, that there should be some sort of plan set in place, set forth prior to that event occurring. So to my knowledge, there isn't anything set out right now generally for children widespread, but I will definitely circle back with you on that and find out the information and post it back here.
Thanks, Bren, for your question. And thanks, Dr. Blocker. A very good question. Do we have any more questions? I don't see any more at this time. Again, if we could sum it all up, mask up, look for the symptoms. And if your child is 12 or older, get vaccinated. Any other like final points before we close out?
I would just say that masking is important, but only part of our way to combat the physical, emotional, and mental barriers that COVID-19 has set forth before us. And as we go back to school this school year, it's imperative for parents and caretakers nationwide to protect themselves and their children by, one, wearing a mask, but otherwise protecting your child, showing them that they are cared for, loved, and at the very most, that their emotions matter more than anything else. And that this school year is going to be one for the books. We pray for safety amongst our children and our families.
Amen to that one. I'll have to get my prayer warriors, my sisters, they know who they are. Get ready for that as we begin the new school year. Thank you so much, Dr. Blocker, for joining us. Again, this will be on replay on Facebook and YouTube, and we'll also have it on IGTV. Oh, Dr. Blocker, we have one more question from Ola. She asks, Doctor, did you say alcohol-based hand sanitizer is okay to give to kids?
Yes, it is safe and okay to give to children. And again, you can find the ones that clip on the back. I like the Purell brand myself. I try not to send them with too many additives or smell goods. Any brand is fine, but the less perfume based, just because they're in and out side, and sometimes they can leave their hands sticky if it's too much perfume. So just the regular plain Purell or dollar store brand hand sanitizer is fine as well if you're doing back to school shopping. And you can also send the large pump containers to the class as well. That's a wonderful idea for teachers to have on hand just at her desk or as they enter the classroom, along with a box of masks like this one here is great to send with your children as well. I'm going to send 4 or 5 boxes every few months to my kids' classrooms, and just so that the teachers have them on hand. If there's a sick child, she can put a mask on them if she so well chooses, which I hope that all teachers do going back this school year. But hand sanitizer is wonderful. Wet wipes is great for the lunch bags and also the masks.
Thank you, Dr. Blocker. And as promised, I'm going to give away 3 of the shirts. And our 3 winners are Bren812, Ola, and Who Dat Detail. If you can, please DM me your email and your mailing address so that we can get those shipped out to you, along with the size that you are needing. Congratulations to you guys. And again, thank you so much. We're going to have this on replay. Please share. Sharing is caring, as I tell my kids all the time. And if you felt like this is something that you can share with others, and you gain something with this, help others out. We're all here to help each other, especially as parents. We definitely need it. So again, share. And that is going to be it for us. Thank you again for joining us, myself, Thank you again, Dr.
Thank you,
Blocker, for
Nancy.
all of your assistance here in helping us identify ways to keep our kids safe and identifying the COVID symptoms. So, again, thank you guys. And next week, we will be on vacation. So, we will not have a live stream, but look for us the week after that. Again, love you guys and thank you.